My name is Armando. I'm from San Diego, but I reside here in Cechise, Arizona. Been out here for about 15 years. I'm on Social Security disability for a mental illness. I was diagnosed paranoid schizophrenic. I lost my apartment. Now, nobody rent to me. A lot of folks are trying to make a home out in the desert. A lot of them have mental illness. Mental illness, it's not being addressed. They'd rather tell you to move your camp rather than saying, hey, is there any way we could help you? Seen a lot of doctors. I'm one of the fortunate ones because the funding isn't there anymore. And you just feel hopeless.
The demand for psychiatric services since I arrived here has gone up at least geometrically, and I don't have any explanation for that. I'm seeing far more difficult cases than I used to see when I first started here in 1993. My receptionist told me today that she turned down 8 people for requesting new appointments to come and see me. I could, I guess, accept patients and say, come and see me in 3 or 4 months. It's just too much to do. I probably have well over 350 patients in my case files. Once I did the math in talking with Dr. Sullivan, who's the other psychiatrist here, and between us, we cover an area about the size of the state of Israel. Despite our best efforts, we haven't been able to attract psychiatrists here. There are many jobs being offered at $200,000 to $300,000 a year working for a large institution, and that's certainly more attractive to young doctors. There is just an overall increasing demand for mental health services across the board, and we can't keep up, just the 2 of us here.
Most of my family expected me to die a drug addict or an alcoholic. But I'm all right for the most part. The beat goes on, like I said. I had been off my medication for almost a year because I had got into some trouble. But none of them are felony charges. They're all misdemeanor charges.
Over 6,200 square miles of policing that we do here in the county. But overall, it's a very vast rural county. We did a snapshot here a few months back of what it looks like when it comes to mental health in my jail. On that day, 67% of the people in my jail, which houses up to 300 people, were either pre-diagnosed or currently diagnosed with some kind of mental health disorder. 67%. I consider it an epidemic in our county. With lack of resources in rural counties like Cechise, what happens is it is a revolving door. When you have those with mental health that they steal a candy bar, and this is repetitive, or they're causing disturbances there, the options are limited. The one option that remains constant is the arrest right into a jail. And I'll be the first to tell you, that's not the answer. It's truly not the answer on taxpayers. It's not the answer for those with mental health. The Cechise County Jail is the largest behavioral center in the county for mental health. Nobody else will accept them. It's frustrating because there should be a center that matches my center in the county that's designed for those with mental health. We have an area in our jail for special handling. Those areas 30 years ago was reserved for your murderers, your violent offenders, your sex offenders. Now they're being housed for mental health. We segregate them. Is it the best practice? No, it's not. Is it a realistic practice for me in a rural county that is trying to upgrade jails right now too? You bet. When you have almost 70% of the people in your jail with mental health that are asking for help, that need help, that's a cost. That's a huge cost. It's a huge resource that I don't have.
There's a problem at the jail. They have no availability for services there. They have no mental health services indigenous that know what to prescribe and know how to interface with patients. You know, I would see so many people at the jail that I thought, man, you know, if we just had a chance to do something, we could help them. Certainly not all of them, but some of them need a chance. But because we choose to do that, we create an environment where they're criminalized, and they're going to continue to be criminalized.
Been out of jail, but they don't help me get anywhere to live. I don't have a home right now. I haven't had a home in the last year, maybe? I don't know. I don't remember. I can't remember the last time I had a place to call home. This is giving me my fourth move in less than a month and a half. I go from hotels to apartments, sometimes tents. How you doing, man?
Hello, I'm good.
Good, my name is Armando.
You're renting the room?
Yeah. 38.
Oh, you're on the do not rent list.
Oh, man, that was about 3 years ago.
Yeah, you're on the do not rent list.
It's because I threw up in the room. That's the only thing I did wrong. Can we make an exception only because we're just trying to get this filming done?
No, you said you threatened other guests and others were in the room.
I think you have the wrong person. I threw up in the room. That's what I got in trouble for.
Same birth date. You're on the do not rent. I can't rent.
Okay, that's cool. Gotcha. Thank you. Take care.
Yeah, sorry about
No,
that.
it's no biggie. I can handle that.
I just have to follow the rules.
No problem. I understand that, man. Take care. Have a good evening.
Okay, have a good
Pow. Trying to wake everybody up. They won't rent to me. It's kind of heartbreaking when you walk into a hotel and they tell you you're on the list to not rent to, or whatever you want to call it. I mean, what can you do though?
So on a night like tonight, when you couldn't get into that, where do you go?
Behind Hastings, right there, the alley. I prefer to be out in the open than in a tent in the desert. I prefer to be in an alley. That way I can really watch what's around me.
Unfortunately, what the healthcare system is nationally, as well as here in Cechise County, is your level of care and your treatment is predicated on your economic resources. There's a large homeless population that perhaps may not even have insurance. And because you don't have insurance, there's no place in this county that will provide treatment of care for you. I'm employed with the behavioral health agency by the name of Wellness Connections in the position of a reentry specialist. Wellness Connections is a peer-run organization. We don't really deal with the people that we provide services for on a clinical level, if you will, but more on a personal relationship. I served 15 years in the Department of Corrections. During that 15 years, I met a lot of people that had been identified as people that had mental health conditions. It impacted me directly in that how can a person that has a love for people see somebody in that condition and not have compassion to want to reach out and help that person. When you go to the county jail and you have been identified as a part of the population that have been diagnosed with a serious mental illness, SMI, their first thing is to put you in isolation for any long or extended period of time. It's going to cause your condition to become worse. And then you're released back into a community, untreated, mind you, and expected to have a change in behavior practices. For some reason, we think we can abracadabra a new lifestyle when we've never addressed the issue. So at some fault, yes, we are at fault as a community. Because if I need help and you don't help me and I'm reaching out for help, then you're just as much a part of the problem as I am. We shouldn't expect the community to change behavior practices, lifestyles, when we've yet to address the core issue.
Our problem is funding. Where do we get the funds to help the people that are in jail, help the people that are out, and see that they get the follow-up they need to continue treatment and get to experience life without their psychiatric symptoms?
When decisions are made by congressional people or elected leaders or those that have decision-making power to change mental health issues, it's all about urban America. It's about the populated areas of this country who have a plethora of resources to pull from. Nobody talks about rural America, which makes up almost 90% of this country. For years, we haven't funded this problem. We've avoided this problem, but now we need to come together at the state level, at the federal level, all the way up to the President of the United States and say enough is enough. And I guarantee if we do that, we can make a difference. And it's all about helping each other as Americans coming together. It's time we do that.
If we sat down, spent some time and money, and came up with proactive programs to get people the help they need, we're going to keep building jails and prisons.